Hello friends, and welcome back to my channel. This video is for all of the trans men following me, all of my trans masc followers, and folks who may be considering masculinizing top surgery. Today I want to talk all about top surgery and nipple piercings. Now the focus of this video is going to be on getting nipple piercings after top surgery, but if y'all want to see me do a video about piercings before top surgery and how that can affect things, let me know in the comments down below. But yes, nipple piercings after top surgery. What do we need to know? What goes into doing it? Is it safe? Is it not? Let's jump right in. Now the first and biggest factor when we talk about nipple piercings after top surgery is really honestly the type of top surgery you have. As you may or may not already know, there's a huge variety of different forms and methods for doing top surgery, from keyhole to peri to buttonhole, double incision and T-incision. There's lots of different ways that we can perform top surgery based on your existing anatomy, your existing chest size, your existing skin, your size, your health, and also your goals, what you want your results to look like after top surgery, what scars you do or don't like the look of, if you want to keep your nipples, if you want to resize them. Like whatever your goals may be, there may be different combinations of top surgery approaches and methods and techniques to consider when it comes to choosing your top surgery. You should get the form of top surgery that works best for your body. However, if piercings are something that's really important to you down the line, it may be something to consider different techniques for doing top surgery. Now, most of the top surgery techniques are broken up based on a few factors. One is type and location of incision, and for the most part, that's not going to be the main thing that affects us getting our nipples pierced after top surgery. The other big determining factor in different types of top surgery is how they handle the nipple. Is it completely removed and grafted back on? Is it kept and resized and put somewhere else? Is it kept in the exact same spot it was originally without anything being done to it? All of these factors are what's really going to affect our nipple piercings if we decide to get them re-pierced post-op. And as a trans piercer myself, I really kind of look at top surgery in two distinct categories. And the two categories that I look at is top surgery where the nipple stalk has been kept intact, and top surgeries where the nipple stalk has been removed. What I mean by that is when we think about the anatomy of the nipple, we have the nipple itself as it sits on the exterior of the breast or chest, and then we have the internal structure that leads up to the nipple. So when we're discussing nipples on breasts, the nipple stalk is a collection of blood flow, lymphatic flow, milk ducts, and nerve endings that all lead up to the nipple and connect to the nipple itself. In some forms of top surgery, this stalk is kept intact. So they keep the nipple attached to your body while they're doing surgery. They just kind of like separate it from everything else and put it over there. And then when everything else is done, they put the nipple back into its new placement. You know, when we're doing something like minimal incision top surgery where they're just making some incisions along the side and sometimes along one part of the areola and liposuctioning out the fat, nothing's happening to the nipple stalk, right? All of that anatomy is still kept intact exactly the way it used to be. Then we have kind of like mid-range techniques like buttonhole and periareolar. In periareolar, an incision is made around the areola and the tissue is brought up to meet the nipple, which is sometimes resized, but it remains attached to its stalk. In this situation, the attachment of the new tissue of the chest is happening directly on the nipple. So now we do have an intact nipple stalk, so we do still have blood flow, we do still have nerve connections, but we have a lot of tension that's being placed around the nipple by the attachment of the skin there. There's a lot of scarring that needs to heal there. Similarly, we have buttonhole technique, where it's kind of like a button. They keep the nipple attached to the stalk and underlying nerves. They create the new chest, and then they create a little incision in the new chest, and much like buttoning a button, they slide the nipple through and reattach it there. We're still attached to that stalk, we're still attached to that blood flow and those nerve endings. Some pressure being placed on the nipple by its reattachment on the chest, but not quite as much as there can sometimes be in periareolar. But in all of these situations, we're still keeping the nipple attached to that stalk and that blood flow underneath. Then we have surgeries with nipple grafts, where the nipple is entirely removed from the stalk that it's connected to underneath and then grafted back on in a different location. This is going to be most commonly seen with double incision top surgery, which also happens to be the most common form of top surgery people get. But we do also sometimes see grafts used in T-incision, and I've even had a few clients who had grafts used with fish mouth. So it varies depending on your surgeon and your goal. But when we have a nipple graft, the nipple is removed completely from the stalk that it was previously attached to. So all of those nerve endings, all of that blood flow, all of the internal structure of the nipple is gone. They take the nipple and resize it, and they graft it to a new area on the chest. Now, this newly grafted nipple does still end up having blood flow, but it connects through new capillaries that grow through the area. It is not the same type of blood flow and the same connection to your body as it would be if the nipple stalk were still intact. Now, you might be thinking to yourself, Lynn, this is all very technical. I just want to get my nipples pierced after top surgery. And I know that it's a lot to consider, but it's very important because you have to think about the fact that we are talking about removing your nipple from its primary blood supply, its primary connection to the body, and grafting it back on in a new place with a weaker blood supply, with a weaker connection to the body, and grafts have a chance of rejecting. So what this means for those of us who are getting top surgery and want to get our nipples pierced afterwards is that we now have nipples that have limited and greatly decreased blood supply, that are not as securely attached to our body as they would be with the nipple stalk intact. And even in some forms of top surgery, if we have kept the nipple stalk intact, we may have some very unique scarring and some very unique relationship between the nipple and the skin surrounding it that we have to consider when we're thinking about getting these pierced. And the primary factors with that are really blood flow and scar tissue. And blood flow is arguably the biggest. This applies heavily to folks that have had nipple grafts, but again, that stalk is removed. You're removed from that primary blood flow to the nipple. White blood cells are how our body heals wounds. It's what's going to fight infection in the area and start rebuilding that wound and healing that tissue. So when we have nipple grafts, we have decreased blood flow. We have a lower ability in our body to bring white blood cells to the site of this piercing to start taking care of it and healing it. I like to compare this to the traffic that we deal with all the time. Imagine one of the main roads in your area that you have to take every single day to get to and from work. Now imagine that they close that road down permanently, and now you have to go all the long way around to get to your job every day. You still can get to your job every day, but now your commute may take 20, 30 minutes longer because you have to go very far out of your way because that primary road that took you right to your job is closed now. You can't drive on it. When we have nipple grafts, when we've removed the stalk, it's kind of like that. Yes, white blood cells can still get to our nipples, they can still work on healing our piercings, but it's a very different process than when they had that nice direct road straight to the nipple. This can mean all sorts of different factors for healing, which we're going to get into later on in this video. But to start, it's really important to understand what type of top surgery you've had, and it's also really important to be honest with your piercer about what type of top surgery you've had. That way we can approach piercing you and healing with you correctly, because healing is going to look different for people who have double incision with grafts than it is for someone who has that nipple stalk intact, who had minor incision or peri or keyhole. And if you haven't had top surgery yet and you know that you're really interested in being able to pierce your nipples afterwards, don't hesitate to talk to your doctor about what your options may be for keeping the nipple stalk intact, how they go about doing grafts and deciding placement, and figuring out what might be the best option for you if that's one of your goals later on. So I just wanted to give that brief explanation of how those different types of top surgeries affect things, because it is really important to know that, and that's kind of going to be the building block for what we're about to get into, which is all the nitty-gritty of getting your nipples pierced after top surgery. And the first element of this is also the one people are not excited about, and that is patience and time. How long after top surgery can you get your nipples pierced is one of the really big factors, and I know you're not going to like my answer, but it is an honest one. For top surgeries where the nipple stalk has been kept intact and there is minimal scarring around the nipple itself, I usually suggest 1 year wait time. This includes minimal incision. This can include button and peri, depending on the type of scarring that's left over from surgery and how this is healed. And it can sometimes include T-incision and fish mouth, depending on how those were performed. However, if the nipple has been fully removed, if you got a graft, if that has been disconnected from the nipple stalk, I usually suggest a minimum of 2 years post-op before we consider re-piercing you. I know that seems like a really long time to wait, but please hear me out on this one. When it comes to nipple grafts, like we already discussed, the whole nipple stalk has been removed, there's very decreased blood flow, and nipple grafts can sometimes have a lot of problems. If you're in any top surgery group online, you know that the 2 big reasons why people come online complaining or upset about their results or needing a revision are dog ears and stuff going wrong with their nipple grafts. I see nipple revisions constantly. That is one of the main areas where we end up needing to do more work. And the other thing is that most surgeons and most other trans folks who've gotten top surgery agree, don't worry about your nipple results if you have grafts until you're at least 6 months to a year in, because the nipple is changing so dramatically over that healing time that you really can't get in your head about how they look at 3 months, because that is not how they're going to look at 6 months, and that is not how they're going to look at a year. Our bodies are not very fast healers to begin with. Our bodies tend to heal things pretty slowly. And not only does your body have very major surgery to heal from after top surgery, but you literally have to regrow blood supply to these nipples. We cut off all their blood supply and we're making your body grow brand new connections to these new nipple grafts. That is an enormous amount of work on your body. And the risks, if we pierce through that tissue too soon, could be as low as a piercing that just doesn't heal, or that migrates out and leaves you with some scarring, or has a really tough healing time, but could be as high as potentially causing you to lose the graft, either from issues with blood flow to the graft and causing some of the tissue to die off, infection from the piercing, especially because you have reduced blood flow, so your body has a reduced ability to fight off infection in that area, or as a side effect of rejection and migration from the piercing being done too soon or done incorrectly, it could jumpstart rejection of the graft itself. So I say this not to scare anyone, but to be honest about the realities of this. I have had clients come to me for advice who were pierced elsewhere, not by me, too soon after top surgery with grafts. They ended up losing the entire nipple over this. Unfortunately, they were pierced too soon, and it wasn't really a great piercing. It started migrating, and they ended up with an infection just about a year post-op, and their surgeon ultimately had to remove the nipple grafts. And not only that, but they consented to go ahead and get that piercing, so they were on the hook financially for their revision surgery. Their surgeon wasn't going to count it as a normal revision covered under hey, this didn't heal right, I guarantee my work, because the client chose to get a piercing. And insurance wouldn't cover it because the client chose to get a piercing, so they chose to take that risk. So unfortunately, they then had to pay out of pocket for their entire revision. It's really no joke with grafts. It's really, really, really important to wait until that tissue is really well established, to wait until there's plenty of blood flow, so that way we know that tissue can have as healthy of an immune response and as healthy as a healing response as possible. But it's also really important because scars change and mature a lot over the first couple of years, and protrusion can change a lot, especially with grafts, over the first couple of years. And again, if you're in any top surgery groups, it's really easy to look up people's nipple healing charts and see how much that protrusion changes year 1 to year 2. So there's also a very high likelihood if you have grafts and you go in at 1 year, a piercer may look and say, these actually aren't pierceable. There's not enough protrusion. There's not enough tissue for me to pierce. And that could change in the next year. You could end up gaining more protrusion as you heal. So it's very variable. So timeline-wise, I generally, please, 2 years is a lot safer if you have grafts. And if you don't have grafts and your nipple stalk was kept intact, you can usually get pierced a little bit sooner. However, the deciding factor is scar tissue. So let's take, for example, periareolar top surgery where they're making an incision all the way around your areola. I have seen clients who healed phenomenally. They had great surgeons, they had a good, healthy, strong immune system, and they had a little bit of genetic luck, and their body heals and scars very minimally. And so at a year in, the scar tissue around the areola is minimal, it's already soft, it's not super raised, it feels very healthy, the skin looks to have good hydration, good collagen, everything's looking great, it's all good color, cool, awesome, we're safe to pierce. Usually these heal very easily. On the flip side, I see some clients who get periareolar and maybe sometimes it's that their surgeon wasn't quite as experienced in this technique. Sometimes it's just that they didn't luck out on the genetic lottery and their body scars more severely. And sometimes it's just that they had a harder time healing. They had more complications during the initial recovery or during the surgery itself. And I see them at the year mark and there is denser, thicker, ropey scarring around the areola. The nipple itself still feels pulled very tightly from where it's bound to the skin around it. The area feels hard or under tension. There's a lot of dry, exfoliating skin. The moisture barrier on the skin there doesn't look very healthy. There's still discoloration. There's still signs that there's healing and maturation going on. In those instances, I'm going to tell that client to wait and give it another 6 months or another year before we consider piercing. Just not seeing tissue that's healthy enough for me to want to take the risk to pierce through it right then. I don't feel confident that a piercing in that situation could be successful. And another big element to this is also scar care. So taking care of your scars after top surgery is really, really, really important. And it genuinely does make a huge difference. I see clients all the time who have phenomenal scar care routines, who are really on top of working with their surgeons and working with their body. They're using silicone strips and they're using moisturizer and they're wearing sunscreen when they go out in the sun. And they're really taking care of their body and their scars look and feel great and I can pierce them and it's no problem. And then I see clients who are not really practicing good scar care, they're not moisturizing, they're not wearing sunscreen when they go out in the sun, they're not really doing anything and they're just kind of letting their body heal as it's going to heal, which as an aside is fine. If that's how you want to heal after top surgery, that is up to you. I have friends who wanted more visible scarring from top surgery, who are really excited about their top surgery scars, and I am here for it. I love it. Please heal how you want to heal. However, if piercings are your goal after top surgery and that scar tissue is not as stable or not as healthy, that's going to affect your ability to get pierced. So if you are opting for a no or limited scar care routine after top surgery and you're just kind of letting your body do its thing, and your body doing its thing is more severe or more dense or just more extreme scarring, that could affect your ability to get pierced. So scar care also plays a really big role in all of this. Obviously it plays a big role with grafts too. Graft care is its own special beast that your surgeon should go over with you. But when we're talking about top surgery where there is scar tissue directly around the nipple like buttonhole and peri, how you take care of that scar tissue can also really determine the final results on your nipple, and that determines when we can pierce and if we can pierce. So now we've established timelines. In general, 1 year if the nipple stalk has remained intact, 2 years if it's been removed, with scarring as the really big modifier on those timelines. So from there, once we've waited our minimum time and our body is nice and healed and ready for us to pierce, next up comes anatomy. Because all piercings, including nipple piercings, including nipples post-op, are anatomy-dependent piercings. There has to be the proper anatomy for me to be able to pierce through it. And it breaks my heart every single time I have to tell someone no to these piercings after top surgery. I want you to know, like, it genuinely does. I fucking hate having to tell people no after top surgery, but you can have anatomy post-top surgery that's not suitable for piercings. And obviously, scar tissue would be a factor in this. If after top surgery, it's just a straight mass of scar tissue or the scarring's really severe, it's not safe for me to pierce back through it. It's an unfortunate reality, but it is what it is. But I would say protrusion is the bigger factor that I see disqualify people from top surgery. Quite often with both grafts and techniques that keep the stalk intact, there ends up being absolutely no protrusion whatsoever. And it's not even where I can manipulate the nipple forward a little bit to get protrusion and get a place to pierce. That nipple is just flat as hell and internally just absolutely adhered to the new chest. And there's nothing for me to pierce through in those circumstances. There's no way for me to put the piercing. And if I were to just lift up a flat nipple and shove a barbell through it, that would just be a recipe for it migrating straight out of you. It'd be no different than if I just took the skin on your chest and picked it up and put a barbell through it. We know that this doesn't work. We know that this doesn't heal. And it's very unfortunate. I hate having to say no in those situations. I never want to, but it's more important that we're honest with you, because when we do a nipple piercing, when there's not enough protrusion, the amount of scarring that can be left from migration and rejection can be really severe, and that scarring can really adversely affect your nipples after top surgery. It could even have like an effect that could end you up with your surgeon again if the scarring is severe enough. So we just don't want to take those risks with people's bodies. If there's not enough protrusion, it may not be safe for us to pierce. Something you can do is always talk to your doctor and let them know that you would like some protrusion as part of your goals from healing, but honestly, it's so variable and it's so dependent on just so many different factors, from your surgeon to their technique, to the anatomy you had before surgery, to how you healed after surgery, how you cared for your graft, how your body healed after surgery, your skin, your health conditions. There's just so many different factors, and there's really no way for a surgeon to go in and be like, I can guarantee you great protrusion for a piercing after this surgery. A lot of it is just kind of luck and rolling the dice and seeing how your body heals. So anatomy becomes our next major fact when we're looking at doing piercings through top surgery. So we've waited a long enough time period after our surgery to get pierced, and we have enough protrusion to get them pierced. Now it comes to actually getting the piercings. And please, 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 please research your piercer. Find a piercer that has experience working with folks who have had top surgery. Find a trans-friendly and trans-educated piercer, and look for a piercer who's got a really good portfolio with examples of nipple piercings post-op top surgery, and not just fresh piercings, but healed piercings too. I have spent this last year trying to put out a ton of content to educate piercers about working on trans folks and trans bodies, and one of the biggest takeaways I have gotten in making that content is, holy crap, a lot of otherwise very good and very well educated piercers really don't know a lot about working on trans people and working on trans bodies. And the amount of times I've talked about doing nipple piercings post-op top surgery with another piercer who's gone, oh, it's just surgically altered tissue, like, I don't see the big deal. Or even piercers who've said, wow, I didn't even know that they removed the nipple stalk. I don't actually know how top surgery is done. Is wild to me. Because as anyone who's had top surgery or is considering top surgery, I feel like can pretty easily understand once you start reading the different techniques and the different methods of doing it, everything hinges on how your top surgery is done. The type of results you have, the type of scars you have, like, I think it's different when you are trans. As many of you who follow me here know, I'm in the beginning of my top surgery journey, like finding surgeons and planning things out. And like one of the first things I feel like you encounter when you start thinking about getting top surgery is having to decide what type of surgery and what type of incision you want. And then you find like surgeons who specialize in that type and things like that. And there's literally hundreds of thousands of threads of trans folks discussing the pros and cons of different incision types and different surgical types and different aftercare types and different scar care methods. And it's really very in-depth and very involved. And it's very important that your piercer understands the type of top surgery you've had and how it's going to affect your tissue in order to be able to approach piercing you correctly. So please, please, please do your research and find a piercer who is knowledgeable about working on trans bodies, who knows what you went through with your surgery and knows how to work with your body to get this to heal safely, and to avoid some of the very serious risks that can come with piercing after top surgery. Now for me as a piercer, the process starts off with a consultation. So someone comes in and I'll take them in the back and we'll do a quick consult and I'll take a peek at the area. I'll feel around quite a bit. These definitely can be more tactile consultations and piercing processes than others, because I really need to feel for the scar tissue that's underneath the nipple, feel for how that tissue is moving and reacting. I like to warn folks that this is a more tactile consultation, because I know for some people being touched in this area, even a couple years after top surgery, can still be like difficult, or carry with it some emotional baggage, or just be not always the most pleasant experience for all of us, especially if you have like weird nerve sensation in your chest after top surgery. So bear in mind that this is going to be a pretty tactile process, but we'll do a consultation. I'll feel around, look at the amount of protrusion we have, I'll look at the tissue health and the skin health, and then we'll kind of talk about things and we'll talk about what I see. Sometimes this is a really easy conversation. It's a, these look great, your tissue's really healthy, you have great protrusion, phenomenal anatomy for us to do this, let's go talk about jewelry up front. Sometimes this is a sad conversation where I have to say, hey, so we have to wait longer to pierce, or I don't think piercing you is going to be an option at all, and here's why. And I'll always explain what about it makes it not viable for piercing. And most of the time, that conversation is middle of the road. It's been long enough, and we have enough protrusion to pierce. However, with certain things I'm seeing with your anatomy, with certain things I'm seeing with your nipples, I'm concerned that these might have a higher risk of migration or rejection. I'm concerned you might be looking at a more difficult healing time. I'm concerned that I can't guarantee that these will heal. And then we sit down and we have kind of an informed consent conversation where I talk about what I see in your anatomy that is a little concerning to me, where I think the worst case scenario of those concerns could leave, and how I as a piercer would approach trying to minimize those concerns and make sure we avoid a worst case scenario. And then we decide together if those risks sound reasonable for you and you're like, yes, I'm okay with those risks, or I trust that you have a really good plan to mitigate and avoid these risks, and we move forward and pierce. Or sometimes we have this conversation and you say to yourself, man, I'm really happy with my current results from top surgery. I don't really want to take any risks with that, especially not for a body piercing. So I don't think piercing is for me. And that consultation is really important, because I really, really, really like to be abundantly honest with my clients. And again, when we're talking about post-op top surgery nipple piercings, especially given that double incision and grafts are like the most common form of top surgery, these piercings carry risk. Like I said, in the most severe circumstance, you could lose the graft, you could lose the nipple. We're going to do everything in our power to avoid that circumstance happening, and a lot of that is saying no to piercings that don't have the right anatomy, saying no to piercing too soon, but also being honest when someone has anatomy that's not a no, but it's not perfect. When it's somewhere in the middle, we're signing up for more risk. So it starts with that process. After the consultation, I usually have you hang back out in the lobby while I get everything sterilized and set, and then we move on to piercing. You'll notice I skimmed right over jewelry selection, because with me at least, if you've had top surgery, you're probably not going to get a jewelry selection. You are going to get plain implant-grade titanium barbells, and this is for a couple of reasons. One, I want to use something that's really hypoallergenic that I know is going to be body safe. I don't want to take any risks with surgical steel or stainless steel. I want an implant-grade material, and I want something that I know is safe for you. If you have verifiable problems with titanium, we'll look into an alternative material, but other than that, everyone's getting titanium. And we're also doing basic jewelry because, quite frankly, I am not worried about making these piercings look cute. I'm not worried about making these piercings look pretty. I'm worried about doing piercings that will heal. And once they heal, we can worry about making them look good. But my main goal for my clients, especially with something as advanced as post-op top surgery nipple piercings, I just want them to heal. I just want them to heal. So basic jewelry, plain titanium barbells, plain beads, easiest to keep clean, easiest to care for, easiest to monitor, and we'll worry about the fun stuff later. So I sterilize everything, and then I bring you back in the piercing room, and we actually start the piercing process. There's a video of me doing some post-op top surgery nipple piercings here on my page, which I'll go ahead and link up in this video for you. But it's a lot of marking and a lot of measuring, during which time I try to really discuss kind of where my mind is at, what I'm thinking about for your piercings, how I'm considering placement, what I'm thinking about for care and healing, all of those factors. And I tend to do quite a bit of marking with post-op top surgery nipples, just to make sure that it's really clear where the right placement for these piercings are, and also to take time to really communicate with you clearly about where your piercings need to go. Now, when we're working with anatomy that's post-surgical, we're really oftentimes limited in our placement. And what I mean by that is you may come in with a goal of nipple piercings that are perfectly parallel to the floor. You may come in with a goal of nipple piercings that match the angle of your top surgery scars. You may come in with a goal of perfectly vertical nipple piercings. I'm going to listen to those goals and try to respect those goals as best I can. But depending on the way your nipple was reattached to your chest, the angle that it sits at, how it protrudes, where I feel scar tissue, I'm going to place the piercings where I think they have the best chance of healing. And that placement is not always the same as the piercings you came in hoping for. A lot of times we end up having to follow the new natural base of the nipple where it's been reattached to the body, and that can oftentimes be at like slight angles, and sometimes it's not the exact same angle on either nipple, especially if they were reattached in different ways, or one had like more difficulties during healing than the other. And the cool thing about this is that it's that way with cisgender anatomy as well. When I pierce cis masculine chests, very often I see nipples that are two different shapes or two different sizes or sit at two different angles. It's really fairly common for cis men to have like one nipple that sits like vertically up and down, and then the other nipple resting like horizontal or at an angle. And sometimes that means how we have to pierce through them is really similar, but not exactly the same. I always joke around and say that they're brothers, not twins, just like eyebrows. So bear in mind that placement on these is far more important that it's placed for them to heal well and last you a lifetime than an exact aesthetic goal. And I'm going to try my hardest to hit that exact aesthetic goal. But again, my goal is piercings that are going to heal well. Then we move on to actually doing the piercings. Feedback from my clients is really mixed on this. A lot of folks, especially with grafts, have really decreased sensation in their nipples. So it really, honestly, is a lot easier than it was before top surgery to get pierced. Some people have increased sensitivity in their nipples because of surgery, and it's a pretty intense piercing. I will say, when it comes to doing post-op top surgery nipple piercings, these are really precise piercings that have to be done very precisely, and we're piercing through oftentimes a lot of scar tissue. They're by no means a slow piercing, but they're not as fast as some other piercings would be, or nipple piercings on anatomy that isn't literally made up of scar tissue. So that is something that I will be honest about. That is something to kind of expect. Some folks will ask me about using numbing cream. Numbing cream is super not safe in general. I have a whole blog post about it on my website, but it is extra not safe when it comes to post-op top surgery nipple piercings. And this is because numbing cream typically has a vasoconstricting element, so it constricts the blood vessels, and tissue that has been numbed feels very different than tissue that hasn't. I've worked on enough numb tissue. It has a denseness and a firmness to it that other tissue doesn't. And when we're doing post-op nipple piercings, again, it's a very tactile process. I can see some of the scarring and some of the anatomy, but I'm mostly operating by feel. I'm feeling the scar tissue, I'm feeling the anatomy, I'm feeling for where I can place the piercing. And while I'm actually performing the piercing, I'm feeling to make sure that I'm in the proper depth and the proper placement on your body. So if you have numb tissue, I can't feel for any of that. And the chances of me putting the piercing in the wrong spot or doing the piercing and not having it in the proper depth are really high. And when those things happen, that's a recipe for migration and rejection. And on post-op top surgery anatomy, rejection and migration can be a recipe for an infection and more serious issues. So we don't want to take that risk. Unfortunately, numbing cream is not going to be safe for these. But with a really good piercer, a really knowledgeable piercer using good tools and good technique and good practice, it is certainly not the worst. And I would say I would rather get my nipples pierced multiple times than the feeling of having drains removed. So if you got top surgery, you're going to be fine. You've got this. You've already gone through significantly more discomfort and unpleasant sensations. Drain removal is, bleh, I hate it. No thank you. So don't worry about it. You got this, but no numbing cream. Aftercare for post-op nipples is sometimes pretty different than traditional aftercare. Aftercare can vary. There have been times with certain anatomies, we've had to worry about wetness irritations on the nipples, so we've had to incorporate drying. There's been clients who have dealt with the opposite, excessive dry skin, especially with that scarring, and especially on surgically altered areas. So we need to figure out a way to incorporate keeping the skin hydrated and healthy into the healing process. Some people may need to wear protective layers, wear like undershirts under their clothing to prevent catches or snags, or especially clients who work certain more physically active jobs where we're concerned about snagging. Aftercare should really be tailored to your personal situation and your needs. Again, when we think about how diverse the range of top surgery options are and top surgery affected anatomy is, it makes sense that the aftercare for someone, again, who had minor incision, no incisions near their nipples, everything internally has been kept completely intact. They basically just had some extra fat tissue lipoed out and that's their new chest. That person's aftercare is not going to look the same as the person who had quadruple H cups removed with double incision, had a revision for dog ears, had a revision on their nipples, has a ton of scarring, and, you know, just no longer has any of those internal structures. Those two clients, completely different experiences with getting their nipples pierced post-op, and they may need completely different aftercare. And this kind of comes back to finding a piercer who's really knowledgeable and experienced in working with trans bodies and who's going to be able to tailor aftercare for you to figure out what works. And really a big element of this is just really regular contact and communication. When I do nipple piercings for folks post-op, I suggest they follow up with me, typically monthly. It doesn't have to be in person, it can be virtual. You can send me pictures of how these piercings are doing through email or DM or on my website, or you can come in person. I do prefer in-person checkups because it helps to see and feel the tissue, but I like to heal them with my clients because I know that these are more difficult healers. So by staying in touch regularly and communicating often throughout the healing process, I can tailor and make tweaks to the aftercare as needed. And if we need to lengthen or downsize jewelry, we can do that. But I like to take a really active role in the healing process of these piercings. And I would say any piercer that's really working on such surgically altered tissue should be taking a more active role in your care and your healing, and should at the very least have you on a schedule with some level of regular follow-up. For me, I like monthly. Sometimes I do even more than that. If I have anatomy that I'm really concerned about, or the client I feel like might have a really difficult healing process or is having a difficult healing process, we might be talking like once a week, just a quick check-in, like, hey, here's how they're looking, here's how things are going. So just, you know, your piercer should be willing to work with you on healing these. Healing these can be harder, so just really, you know, have a piercer who you trust, who you know is going to support you and be there for you with any questions you may have during the process. And healing timelines. Healing timelines are usually prolonged. Even in the best case scenario of top surgery, usually at least a year to heal. I have definitely had double incision and nipple graft clients looking at a 2 to 3 year heal time. They do still heal, but again, remember that analogy of the traffic jam when you're going to work. The white blood cells can still get to your nipples, but their main highway is closed. They gotta go the long way. So things are gonna take longer. It is not uncommon for these to have much, much longer healing processes. And that is something that you should understand going into getting these, and that is something that you should be prepared for, that you can still be cleaning and caring for and actively healing these well into a year after getting them, and that there are many cases of folks taking 2 to 3 years to heal. So patience is definitely huge with these. And lastly, I just want to be really honest about the risks. I think the piercing industry sometimes struggles with informed consent, mostly because it oftentimes lacks the information. It's one thing to say, hey, these piercings are pretty difficult and they can be harder to heal. That is an uninformed consent, you know? Remember when you're thinking about getting surgery and your doctor sits you down and is like, you could die in surgery, you could get a life-threatening infection, like this could go horribly wrong, you could need like all of these different revisions, you could have all of these problems. Here's the statistics of people having these problems. Here's the statistics of people regretting getting this surgery done. Like, your doctors really don't pull any punches when they sit down and talk with you about those risks. And it's not because they're trying to scare you or they're trying to dissuade you from getting it done. It's because it's really important that you have that information to consent to this, because you can't give consent without that information. And the same goes for piercings. These piercings do have a higher risk, and the risk can be very serious. We could be looking at something that lands you back on your surgeon's table, needing a revision if things go really wrong. And your piercer should be honest with you about that, and you should understand that risk. Now, that being said, it reminds me a lot of the risks of top surgery itself. Yes, there's very serious medical risks anytime you get surgery, anytime you go under anesthesia. But those risks tend to happen in very, very, very small amounts of cases, and a lot of that risk is minimized by having a good surgeon or a good body piercer, being prepared for the surgery, and also the healing process and making sure you take care of your incision sites to avoid infection and don't overexert yourself while you're healing. Same thing with a piercing. A lot of those risks can be minimized by good aftercare, long enough after surgery to get pierced, starting with high quality, safe body jewelry, and making sure you've got the right surgeon or piercer. So there are real risks to post-op top surgery piercings. There's not always a guarantee that they heal because this is such difficult tissue to work with, but those risks can really be minimized with a good piercer, with a good aftercare, and just really being willing to work with your piercer and work together as a team to work on healing these. There's obviously a lot that goes into post-op top surgery nipple piercings, and my hope is that this video can share a lot of light and education on this for clients who are interested in getting this done, to help you feel more educated and prepared to make good decisions about when you get these piercings, about who you trust to do these piercings for you, and about what's going to go into the process in getting and healing these. And for any piercers or anyone in the industry watching my video, I have a whole bunch of content about this exact topic, but in depth for piercers that goes over technique, exactly how I approach doing these piercings, anatomy, consults, jewelry, all of that over on my Patreon. So if you're interested in actually learning about top surgery and about how to perform these piercings for trans clients, and you want to support a trans piercer and a trans person in doing so, you can go subscribe to my Patreon because all of that is over there. Of course, you guessed it, this video is sponsored by Plume Gender Affirming Healthcare. They are one of the best companies to work with, trans-owned, trans-operated, to get accessible, affordable healthcare all across America and slowly branching out. They make hormones and hormone replacement therapy very accessible, and they also offer letters for gender-affirming surgery. So definitely check them out. I'll link their info in the video description, and they are really a huge driving force in me being able to make so much trans educational content, and I really love that company from the bottom of my heart. As per usual, if you like this video, if you like the content that I put out, please hit like and subscribe. It means the world to me. Your support is what allows me to keep doing this, and I'm sure we'll sit down and chat again soon. Have an awesome rest of your day. Bye!